entire process took about 5 years from conception to realization. So first people just started talking about the process. Then about 2 years ago, we had our initial consultation to the American College of Surgeons. And this visit was really just to get us to the point where we knew where we had to go with the program. We wanted to get their advice about how to implement some new strategies and as well as to develop our peer process for trauma.
Part of being a trauma center is having what we call activations. And when we identify somebody either in the field or somebody who arrives without any notification, when we identify that they have a traumatic injury that requires immediate attention, we have a protocol in place where we bring all the appropriate resources to the bedside immediately. That's what we call a trauma activation.
In pre-hospital trauma, every second counts. We have an industry benchmark, which is 10 minutes from the time that we encounter the patient to the time that we are on the road to the trauma facility. So those 10 minutes go by incredibly quick, particularly because oftentimes we're having to intubate the patient, secure their airways, establish IVs, give medications, decompress lungs, among other things. So it's incredibly important that we are thinking on our feet and we make those appropriate decisions as promptly as possible.
We're able to provide 365-day, 24-hour care for any related trauma, but now we can have outcome studies, protocols to improve our communication with ancillary service, the radiologist, as well as the general surgeons.
It means a higher level of training for everyone, which is always a good thing. It also means that the patient is receiving the best possible care. We are all trained now to take care of traumatic injuries and do it in a timely manner. I've seen the end result of having a trauma centre, and trauma centres save lives, they do. The coordinated care, the coordinated approach means that the patient gets what they need straight away.
So the trauma department really encompasses the entire hospital. The moment the patient comes into the emergency department, and even before then, because we're very involved with EMS and making sure that they're following our guidelines and protocols as well, and that we have a streamlined approach to these patients. So it literally starts from the time that a patient is evaluated by the paramedics, brought in through the emergency department, all the way up to the time that they get to the ICU or floor and they're cared for by the team upstairs. Everybody pretty much in the hospital is touched in some point by the trauma program.
Being a level 3 trauma centre is a great thing for our community and for visitors. It means a higher standard of care. It means that we're constantly monitoring how we provide care, and we just keep getting better at it.
Firefighter paramedics in our area are well-trained professionals who want the very best for our patients. And having a trauma center that is local and nearby and allows us to transport our patients within a very reasonable amount of time is incredibly important and is a true asset for our entire community.
We want to provide the very best in trauma care so that we can make a difference in our patients' lives. A Level 3 Trauma Center is the right size trauma system for a community our size. And it takes all of our assets, our skilled orthopedist specialists, our anesthesiologists, ER physicians, radiologists, all of our doctors, including our trauma surgeons, to help provide excellent care.